Hello friends, welcome back to our YouTube channel Doctor's Corner. In this particular lecture of less than 10 minutes, we are going to discuss about one of the very important phenomena related to the coronary blood vessels, that is coronary steal syndrome. Okay, coronary steal syndrome. It is also known as cardiac steal syndrome. Coronary steal syndrome or cardiac steal syndrome, or just it can be also termed as this one, coronary steal phenomena. Okay, so cardiac steal syndrome or coronary steal syndrome or just coronary steal phenomena. Now what exactly this coronary steal syndrome or phenomena or cardiac steal syndrome means? Okay, so before coming to the exact definition what exactly it means, I'll just highlight you and explain you what this phenomena is, then we'll come to the definition or what exactly it means. Okay, now consider this as a coronary blood vessel. I hope you know what is coronary blood vessel. Coronary arteries, okay, or coronary veins, that is a coronary arteries more specifically. So there are different coronary arteries. We will discuss in detail about the coronary circulation in some other subsequent videos. Right now in this small lecture we are just concentrating on this topic, coronary steal syndrome. So consider this as a coronary artery, and these are the coronary artery branches. Which artery left, anterior descending, circumflex and all, we'll discuss next time. Just time being, just to understand this phenomena, consider this as a coronary blood vessel which subdivides into two important branches. Okay, this is branch number A, this is branch number B. Okay, now this is just an hypothetical example we are giving to understand this phenomena. Now in this branch number A, suppose in this blood vessel there is a blockage or there is a atheroscleromatous plaque. Okay, some abnormality has developed here, some plaque is there or atheroma is there which is blocking the blood flow. Okay, and this blood vessel B, okay, and this is having normal caliber blood vessel, no abnormality is seen. Okay, so in this both these blood vessels consider having the same diameter or more or less, whatever it may be. Okay, now consider this thing, consider this blood vessel A is supplying to this zone, okay, of myocardium, and consider this as the blood vessel B supplying to this zone, that is of myocardium. Okay, this part of the myocardium or the heart muscle. Okay, now what you expect? The blood flow, whether this the blood vessel which is supplying by the the part of the myocardium which is supplied by the blood vessel A is more or less? Definitely it will be less here. Okay, that is called as ischemia. Ischemia means decrease in the blood supply to a particular tissue. Okay, that is called as ischemia. Okay, now due to this ischemia and how this ischemia will occur in the flow, you have to go to the Ohm's law, so which states that flow is directly proportional to the pressure gradient and inversely proportional to the resistance offered by the blood vessels. Okay, so pressure gradient means the pressure difference between the two ends of the blood vessel, and resistance is the resistance to the blood flow. We'll discuss in detail in the hemodynamics regarding this Ohm's law, but this is related to this blood flow relationship. Okay, now flow is inversely proportional to the resistance and directly proportional to the pressure gradient. Now so forget about all this thing, come to this point. Now obviously due to the ischemia in this blood vessel A, the blood flow will be reduced to this particular part of the myocardium or the blood this one heart muscle. Right, now due to this ischemia there is something known as auto regulation or local regulation. So with the help of this auto regulation and local regulation, some substances like adenosine and all are released locally, and it causes the dilatation of this blood vessel. Dilatation or dilation simply. So what do you mean by the dilatation or dilation is this, it will causes the diameter of this blood vessel. Okay, because of this obstruction to have a normal blood flow to that particular part of the myocardium, there is some sort of the vasodilatation by the local adjustment mechanism by our body within the this blood vessel in the ischemic zone. Okay, now as hypothetically, imagine here there is everything is fine, there is no ischemia though, so nothing changes in this diameter of this particular blood vessel B, okay, and the blood flowing to this is normal, and however it has adjusted its blood flow, and there may be collaterals also, there will be collateral circulations also in between this blood vessel, whatever it may be, have a collateral circulation will develop anastomosis, we'll discuss about that later. Timing, remember that the blood flow is adjusted, but sometimes due to some work or some exertion it will lead to angina. Angina is basically the chest pain. We'll discuss about this topic in detail, angina, ischemia, myocardial infarction, because it is very important clinically as well as for the common people to understand this concepts of heart attack and myocardial infarction. We'll discuss later. So timing, remember, because of this ischemia it may cause angina. Now to prevent this, a drug called as dipyridamole is given IV. Okay, it is a powerful vasodilator drug. Okay, it is an anti-anginal drug or anti-platelet drug, dipyridamole. So this dipyridamole, what it will cause us is, it is a powerful arterial vasodilator. It will not act on the larger arteries but the smaller branches. Okay, so now imagine if this infusion of the dipyridamole is given to a patient in whom already there is a ischemic area and a normal area also. So what will happen? It will dilate both these blood vessels, that is blood vessel B as well as blood vessel A. That is, it will increase the diameter. If you increase the diameter, the resistance is decreased, so the flow will increase, right? The flow is increased, but the diameter of this blood vessel B is increased, that is the normal blood vessel, and this is also increased but to a lesser extent, because it is already dilated by the auto-regulatory mechanisms or the local regulatory mechanism. So already the limit has reached, only a small amount is dilated, okay, what was already, but this is dilated now. What will happen? So just hypothetically imagine or consider if there is 100% of the blood flow through this. Okay, I'm not going in detail about the pressure, resistance and all, just imagine in percentage, 100% of the blood flow is going through this one of the bigger blood vessel, and there is obstruction here in B. Okay, now suppose equally it is spreading to this, both this, that is 50% of the blood is going to the blood vessel B and in A, and 50% is going to the blood vessel B normally, and because of this block in this A, it will cause us vasodilatation and this one. But when we give an infusion of this dipyridamole, which is a vasodilator, okay, which is a vasodilator, then what will happen? Now because of the dilatation of this, dilatation of this blood vessel, now it creates a vacuum and more amount of the blood comes to this blood vessel B, which is a normal, which is not at all required, but still the blood will come here. So out of 100%, now what will happen is, because of this drug dipyridamole, which is a vasodilator, 70% may go here. I'm just speaking hypothetically, 70% may go here and remaining 30% will go to the already ischemic part. Now what has happened? Already this part was ischemic, that is blood supply was less because of this, and however it's adjusted that. Now because of the infusion of these or due to some exercise, when there is a natural vasodilatation or vasodilation, so more amount of the blood goes to the normal area. So this phenomena is called as simply coronary steal syndrome or coronary steal phenomena. Steal. So what exactly it is stealing is, it is stealing the blood of the already compromised blood, compromised area in the myocardium. That is, coronary steal syndrome means it is the redistribution of the blood flow or the blood supply in the coronary vessels because or after the injection of this dipyridamole or after the exercise. So the already ischemic area will get less supply and the normal area will get more blood flow. So because of this vasodilation, then this phenomenon is called as coronary steal syndrome. So other drugs which will cause us this coronary steal syndrome or phenomena is like hydralazine and isoflurane. Okay, there are again plenty of the list goes on, but important one, these drugs causes this thing. So just to summarize, what is coronary steal syndrome or steal phenomena? It is the redistribution of the blood flow in the coronary vessels after the injection of a vasodilator or after the exercise okay, and where the blood flow is increased in the normal vasculature because of the decrease in the resistance, and flow will increase, and there is in fact decrease, and because of this decrease again there is angina or other symptoms, okay. It is actually worsening the symptom. So this drug, it is called as pharmacological success but therapeutically failure. Pharmacological success means the purpose of this is to cause vasodilatation, it is doing its purpose, but what is the use? Therapeutically it is a failure. In fact, it is causing the opposite effect, that is, it is again causing the angina, chest pain, dizziness and other symptoms. It is aggravating, though it is made for a good purpose to cause vasodilatation, that is pharmacologically it is a success drug, okay, but therapeutically it is failure because of this coronary steal phenomenon. Hope you like this video. Please share and subscribe our channel Doctor's Corner for more such videos. We are making such videos frequently from all the subjects of the MBBS, right from anatomy to medicine, and we are explaining in English as well as in Hindi language. So please subscribe to us and share the link with your friends. Thank you. Have a nice day.